New approach to control high blood pressure. National Heart Month is devoted to growing knowledge behind cardiovascular disease (CVD) because awareness is a key. When we know the tattletale signs of CVD, we can assist ourselves and our loved ones avert the sometimes deadly side effects from these conditions and seek the correct aiding if needed. In this blog, all this talk about avoidance and treatment begs the vital question: can high blood pressure (HBP) and cardiovascular disease be controlled? Chronic conditions is the main reason for cardiovascular conditions. High blood pressure can be a lifelong and chronic condition. Chronic conditions are aided in a very different way than traumatic events in the medical world. Chronic treatment engages in targeting the possible root reasons for an issue, not simply addressing indications. Conditions like HBP and CVD, in order to be handled, need to define a cure targeted at the root cause of the subject. Lifelong aiding plans have great achievement in lengthening the life of the sufferer, as well as mitigating the negative effects of the particular condition. Do normal protocols control HBP, while the above protocols definitely address some of the everyday pain and symptoms that can take place with high blood pressure? Sometimes even with changes in daily life and adhering to your medication regime, you still may feel high blood pressure. Oftentimes persons are prescribed up to 3 or more medications yet still notice their blood pressure readings too high. When this occurs, a solution feels out of reach and those can feel bad and their value of life reduces while their stress increases. In order to direct uncontrolled high blood pressure, option and new therapies offered through an alternative treatment may be the best next step. Emergency treatment for high blood pressure in hospital surroundings. Injectable drugs may be utilized for emergency treatment of high blood pressure. The most usually used are labetalol, normodine, sodium nitroprusside, nipride, and nicardipine, Cardine. Emergency medical therapy is essential for victims with severe, malignant HBP and in victims with short-period, acute, congestive heart failure, dissecting aneurysm, dilation or widening of the aorta, stroke, and toxemia of pregnancy. Aiding with combinations of drugs for high blood pressure. The employ of combination drug therapy for HBP is general. At the period, employing smaller amounts of one or more drugs in combination can reduce side effects while increasing the antihypertensive effect. For instance, diuretics, which also can be employed alone, are more often used in a low dose in combination with another class of antihypertensive medications. This way, the diuretic has fewer side effects while getting better the blood pressure lowering effect of the other drug. Diuretics also are mixed to other antihypertensive medications when a victim with HBP has fluid retention and swelling, edema. Don't forget to like and subscribe to our YouTube channel for more related videos.